Welcome back to the All Things Substance Podcast. This is episode 143. This week is the third out of four episodes that we're going to be doing in preparation for the event Braving the Course. This event is our second annual, and it'll be happening on August 28th at 6 p.m. Central Time, going to about 8:30 Central Time. For those of you who aren't able to attend live, there will be a replay afterwards. All you need to do is sign up and register, and the event is free. It's at betsybyler.com/braving-the-course. We will say that again, probably maybe a couple times, and it's on my website, and you may even see stuff in our Facebook groups and wherever there are therapists. We're trying to get the word out. So please feel free to invite colleagues. Jenny's and my desire is to support all of you as you do this really important work. Today, we are talking again about how trauma and substance use intersect. In the last two episodes, we talked about how they intersect and that substances are actually a pretty effective way to deal with feelings in the moment. We're not saying that people should, it's not necessarily adaptive, but it is effective. And in fact, a lot of our techniques are going to have a really hard time competing with substances like alcohol or marijuana. So then we got to talk with Jenny about what it is like to do that balance between being vulnerable and open in session and not getting burned out and overwhelmed and drained. And she walked us through a technique called soft front and strong back. If you haven't heard that episode, you can head over to betsybyler.com/podcast and check out episode 142. Or wherever you listen to podcasts, it's the All Things Substance Podcast. And again, it's episode 142. So for today, the question that comes up is, okay, substance use is a thing. Yes, I have clients I know that are using. I don't know what to do next, and I'm not sure where to start. And so that was the thing that Jenny and I, when we talked today, discussed about how we wanted to bring this up. And I get that question a ton. And so that's where we're going to be. Again, I'm Betsy Byler, if you don't know me, and I am an EMDR therapist and a substance use counselor. I am mom of two grown kids and a cat mom, and live in the northwest woods of Wisconsin, even though I am a Chicago girl at heart. So I'm going to turn it over to Jenny. So for those of you who don't know Dr. Jenny Hughes, that she can introduce herself. And we have a guest with us today. So if you hear him, he's our special guest.
Yeah. So for everyone watching, we also have this posted on YouTube. You'll be able to see a little baby head. My son is with us today because of life. That's just how things are working out today, and that's okay. So thank you so much, Betsy. I am a psychologist and a trauma therapist. And I too am a mom of two kiddos, and I live in Houston, but I'm from Colorado, which is where I am right now at this time of the recording, which feels so nice compared to being down in the South and all of that awful heat. So I'm really grateful to be here. And being able to, and I run the Brave Trauma Therapist Collective. That is a big part of the work that I do as a trauma therapist, is helping to support other trauma therapists in the work that they love. And what you brought up, Betsy, about the theme of our episode today of, okay, so where the hell do I even begin? You're saying that we need to be meeting our clients where they're at when there's an intersection between trauma and substance use. And okay, cool, I can be open to it or whatever you're trying to say, Jenny. But then what, right? And it can be so hard to just ask some of these questions and to have these kinds of conversations. I think a lot of times, for me and other therapists that I've spoken to, there can be a hesitation because you don't want to come off as judgmental. It can feel like you're prying, right? Like it's like too personal, even for a therapist, to ask their client about substance use. And so, even when we're in agreement that yes, trauma and substance use are linked, yes, we want to be open to this work because we know that it is and can be incredibly rewarding, still we're hesitant. We don't know what to do. So, how do you help to support therapists in just taking that first step?
So I want to start by kind of dispelling a couple of, I don't know if they're myths necessarily, but fears, assumptions about what it is that I want folks to do. And I have been in this field 20 years. I've been a supervisor, and I've walked a lot of folks through this beginning step. My goal is not to work with substance use counselors, although I have done that to teach them mental health techniques, but to help your average outpatient mental health therapist how to step into this and not specialize, not get into the deep end, but to be in this problematic use. So I differentiate between problematic use and addiction. So I'm talking about this space between full-blown addiction and normal use, because using substances is normal. This is
Mm-hmm.
just something that we do to celebrate or to when you were with friends or whatever. So there's a really normal range. It's when it starts causing problems that's where I'm talking about. And
Mm-hmm.
for us, when people are using it to cope, that if that's their only coping mechanism or their main one, it's not super awesome. And it's gonna, because tolerance is a thing and progression is a thing when it comes to substance use, it's not gonna work forever.
Mm-hmm.
So you don't, as a therapist, your job is not to get them sober. Like that is not the goal. If they want to, like, great, you can support them. But that is not the goal here. The goal for you is to allow substance use to be in the room, that they can talk with you about it, that you are normalizing it, that you're like, hey, I get it. The trauma that you've been through is overwhelming, and this helps immediately. I totally can see why that is. And so you are not trying to make them quit. You're not trying to convince them. You are
Mm-hmm.
not trying to force them. You are not pulling them in any way forward. You are helping them determine for themselves what they want and to see if their substance use is in any way getting in the way.
Yeah,
And
and
then,
a
go ahead.
couple things come up for me around that. So, one, that sounds great if you do it at intake, right? Because it's like you're already asking all of the nosy questions, and so anything is fair game. So, that's one piece of like, how do we do this if we haven't asked about it? And coming back to like the like feeling judgy or nosy, I agree with you in terms of supporting therapists and trauma therapists in addressing the problematic range. But I kind of feel like that is exactly where it does feel judgy. Because, in that problematic range, our clients, depending on their level of awareness, may or may not realize it's a problem. And it can come across as like, well, I'm not an addict, like, why are you asking me these questions? And it can feel really scary as a therapist and worrying about the therapeutic
Mhm.
relationship and things like that.
And so I want to address, I think those are really important. So one of the things that I have talked about, and in the show notes on the web on my website, there will be links to things that we've talked about. And so when you go to betsybyler.com/podcast, you can find this episode. But I did a 1 hour training on how to bring up substance use, but I'll just be really brief and say, oftentimes when we bring up topics, and especially substance use, even for me, I don't want people to be like, do you think I'm a drunk or whatever?
Mm-hmm.
And so I'll have to say, is if I've known someone and I maybe didn't assess or whatever, or I've asked them in the past and their answer was no, and now I'm like, I don't know about this.
Let's
And so I'll
revisit.
say, right. So I'll say, when kind of the way I do stuff in session is I'll say, tell me about your week. And then I'll say, is there anything specific that you want to talk about today? And I might say, so there's a couple things, there's something I was thinking about that I thought we could talk about, but I want to check in first about where you're at, about what you want to talk about today. And if they're like, no, I don't really have anything, just say, okay. So I was at this training the other week, or I was listening to this podcast about trauma and substance use. And I know that we've worked on trauma, and substance use is something that gets like, so we're talking like drinking or smoking weed or whatever. And I'll use those phrases rather than substance use. Like I'm gonna cut it off, because if your person is using anything bigger than that, you likely will know, because after a certain limit, people don't wind up in outpatient therapy. Like they just wind up in treatment because they're involved with the law. So anyone who's using like heroin, meth, cocaine, like they might be like dabbling in it and still be in your office, but when it's really severe, those people don't show up often for us. That's
Right.
just how that works. And so I'll say, I don't know much about your history with drinking or like marijuana use, and I want to check in about it because I don't know. And because it can be people's go-to, especially like when they're younger, I just want to check in. And so finding a way that is not clinically like stilted and go whatever goes with your style of taking it from substance use and being like, so lots of people when they experience trauma might be drinking more, or they might start smoking weed. And I just want to know what your history is, and if that's ever been something that's that you've used to manage trauma when it was overwhelming. And if they feel defensive, if you get that, you can back, in your own, just be like, so I want you to know I don't have any opinions about whether or not you've been using, whether you've been drinking or smoking weed. Like, I just want to know if any of that is how you've coped. You've done and you use that your relationship with them to say, you have survived a number of things that were really hard. And whatever you did to do that or are doing to do that, my goal is not to take away what you're doing to cope. I
Because it's
just,
valid.
right.
Like, of course, you
And
are doing whatever you need to do to cope.
right. And so I think finding a way to ask the question, there are a number of places you can kind of get in there. You could ask, I don't know what your family's view, I don't know what your history was with like drinking. How did you grow up in your house? Like, do people drink? Is that a thing that people look down on, or is that acceptable? And so you find a way that's like they can talk about their family. Or I think with some of my younger adult clients, I'll say, so what was like the party scene like in your high school? And you can go there. And so in some places in the country, and probably in other countries, it's similar, that sometimes alcohol seems to be more popular and sometimes weed's more popular. And so I'll just tell them, like, in my high school, it was alcohol. How about yours? And so we go there, and I'll say, well, so did you experiment much? And so we just get a chance to enter into a conversation. And if they are defensive, usually somebody, either they have opinions about their own use, right? And we're poking on something. They might feel
Right.
like maybe I'm drinking too much, or somebody else has made in a statement like,
Yeah.
you need to calm down, and it is an opportunity. But finding the like, hey, I was listening to this podcast the other day about trauma and substance use, and that's an easy in. And getting
Yeah,
their
I love
permission,
that.
I think, is really important.
Yeah, I mean, and like it's having that excuse or reason or whatever to bring it up. And even if, people are listening to this podcast today and then they bring it up in 2 weeks, just pretend like you just
Right,
listened to it.
right.
For all the non-clinicians listening, I totally will like blame things on like the agency or stuff like that. Like, oh, sorry, this is just agency protocol. When it's tough or like I need an in, right? Not that I just like same with this, not that we're trying to get a way out of it or to kind of like sidestep it, but sometimes you just need to break that ice, and it can be helpful as a clinician to sort of be able to have like a little bit of an external way to then come back in.
Yeah. And so I think finding that way that suits you, knowing that you you do not need to be asking about every substance on the planet. That's not what you're doing here. This is a brief foray. It's what you're listening for is moments when you're like, oh, that's probably not great. But you can hear that when somebody is shopping and like that retail therapy, right? Or when they're
Mm-hmm.
eating a bunch and then they feel terrible about it. And so then they want to go
Mm-hmm.
on some kind of crash diet. We don't have to be eating disorder specialists to know that that's not a great cycle because there's a lot of
Mm-hmm.
negative self-talk and a lot of shame and we don't want that. And so you're just
Mm-hmm.
listening for if someone's going out and they're getting hammered and hooking up with rando strangers, like maybe they're good with that. And I am, like I'm pretty sex positive as a human, knock yourself out. But if you are doing that and then you have negative stuff in the morning, I don't love that.
Yeah,
Right. And
right.
so
For
we're just
you.
we're just listening for that. Yeah. Because I don't
Yeah.
want shame and I don't want criticism of yourself. And I want you to do things what I want my clients, whatever they're doing, to not do anything they're going to regret if they can help it. And so I want
Mm-hmm.
to help them, whatever their value is, be in line with that. So
Mm-hmm.
the second half of your question, Jenny, I'm drawing a blank on that part. Do you remember what it was?
Well, I mean, we've sort of talked about it like kind of in and out of here about how, with people who are maybe in that problematic range, I think that is when it feels most uncomfortable to ask about this stuff. And so you've talked about that, I think throughout, but I think it kind of leads and builds into another question of like, okay, so then do we want listeners to then just like tell every single client that they just listen to this podcast and they're going to ask them about like how much they drink and smoke weed, or like how do we know which clients to have these conversations with?
Um, so that's a hard one because ideally I would love for I okay, so like caveat, I would love for substance use to be a competency for everyone in the future, all therapists, right? But most of us didn't get trained, most of us. And there's no conspiracy about why we didn't. It just wasn't included. It's a whole thing of, but
And
it wasn't
even when it
because
is,
we're
like, I
not.
went to grad
Yeah,
school in California, I took one summer course on drugs and
right.
alcohol, and it was a total joke.
Yeah.
So,
And and so it's not, it just hasn't been focused. And so we're all like, what do we do with this? Which
mm-hmm.
is my passion. But to answer the question in a hopefully more concise way, um, when someone is highly symptomatic, they're doing anything to survive.
Mm-hmm.
I want to know what they're doing. If they're pretty stable, like so like let's take EMDR for instance. If I've got someone and we're processing often and their symptoms are getting better and like their scores are going down and up like they're supposed to, I don't know if I'm real concerned about that.
Mm-hmm.
But if they're kind of all over the place or like I've done sessions when someone was high, not on purpose, and I've seen that go badly. And so if you're having if you're doing EMDR and some of the numbers are up and down and up and down, like those are all flags to me, or when someone's symptoms aren't getting better when I feel like they should,
Mm-hmm.
that
Yeah.
something isn't working. And so those are the folks that I would
Mm.
I would start with.
Right. So those clients that you're like, God, I don't know what is going on. Like, I need to consult on this or whatever it
Yeah.
might be. Or you're
Mhm.
like almost feeling like you're pulling everything out of your bag of tricks, trying every single intervention, and nothing seems to give.
Yeah, that's where I would start. Because almost
Mm-hmm.
always for me, when I feel like I'm missing the middle puzzle piece, it's like I have all these pieces and I'm like, something is not connecting.
Mm-hmm.
There's either undisclosed trauma that they haven't, either they don't remember, don't know about, or haven't shared, or there's um, some other kind of, for me, what I found is either substance use or some pretty toxic stuff in the romantic relationship that they haven't
Mm-hmm.
discussed.
Yeah.
So, because those are really big things to hide,
Yeah.
but they impact day to
Or
day.
disordered eating, I think, is off
Yeah, that
can
too.
sometimes be in that camp too.
Hmm.
Which there's just so many, and disordered eating is another like great way to cope with our traumas and our difficult
Yeah,
feelings, right? It gives us a sense of control, and then we have a lot of shame around it. And so it falls into this grouping of things that are helpful in the short term, but don't make us feel good. They make us feel ashamed, perhaps. We don't want people to know, so we're keeping secrets.
right.
And substance use is
And
just so, I think it's probably the most common one that's in that problematic range.
especially drinking,
Yeah.
because it just is, it's normal. People will
Yeah.
actually comment if you don't drink,
Hmm.
and that's like the only substance that people are like, why aren't you drinking? Like,
Right. Yep.
and so it a lot of times people don't, and they won't know, especially if you're able to do it at home. And so it is pretty common. And I guess
Yeah.
I want to say to the therapist that, so let's say you've identified some clients that you're like, yeah, I want to ask about this. This could be there. I could see that. Your goal is not to, like I said, to stop them. The goal is get the parameters. And we do this all the time. How bad is your depression? When did it start? What's the highest that you feel in happiness in a day? And then what's the worst? Have you had any suicidal ideation? Like, we're finding the edges.
Hmm.
Same thing with anxiety. Like, have you ever had panic attacks? How often? When was the last time? And the same thing with substance use. We're looking at, like, how often are you drinking? When you drink,
Hmm.
like, what is it? What is it that you like? What is it that, how much are you having? What
Hmm.
is it that you like that it does for you?
Right.
Instead of like, don't you know it's bad? Like, it does something positive. And so you
Totally.
ask them, like, why alcohol and not weed? Or why weed and
Right.
not alcohol? What do you like about it that you don't like about that?
Yeah.
And because people who have tried more than just alcohol have a preference, and
Right. Exactly.
and they can tell you what that is. And
Hmm.
so what you're looking for is getting the parameters of whatever the substance is, and listening for anything you're like, all right, so if you're drinking a lot before bed, it's probably gonna, and you're waking up feeling really tired, like, that's probably not great, because that's a
Hmm.
depressant. It's gonna not let you go through the sleep levels as well, and you're not getting as much reparative sleep. And you're just thinking this, right? Like, you're not
Right.
necessarily talking through it, but that's enough to start. Because
Yeah.
what we're looking for is what's going to get in the way of their healing and the freedom that they want in their lives to move forward. And you are just going to look at that as a behavior of any other
Mm-hmm.
kind. That could be whatever is a maladaptive coping mechanism. We want them to examine if it's serving them.
Mm-hmm. Right,
And
exactly.
if they're down with it and they don't want to change anything, that's fine. We leave it alone.
Hmm. Yeah.
But we have at least addressed it,
Hmm.
and I would document it for
Hmm.
those of you who are super, super risk averse. Um, I don't know that there's anything that's going to come of that, but you just are. It's the same way with depression. I ask about, when was the last time you had blood work? Have you ever had your thyroid tested?
Hmm.
What about iron? What about vitamin D? Like, if I'm looking for what causes could be and I'm not finding it, I'm
Hmm.
not a medical person, but I want to say, do you have have you been to the doctor? Maybe we should have an updated physical blood work. Like, maybe you should do that.
Right.
And then let the doctor decide what's going to
Right.
happen there.
Well, and at Braving the Course, you're going to be going into even more depth about this. So
Right.
tell our listeners more about what you're going to be teaching at Braving the Course.
So I have narrowed down screening questions, and I picked three of the top three screening questions that I think are the most helpful. And I'll be sharing those with you, why I believe they're important and what problematic looks like in response to those
Mhm.
questions. So you're going to come away with really specific information and questions that you can use right away.
Awesome. And that is all going to be part of the PDF workbook that we'll be providing to people too. And so,
Mhm.
you'll be able to attend live, catch the replay, but also have an actual just like I'm definitely like, a paper person, even if it's a PDF, where it's really helpful for me to have resources like that I can like quickly scan right before a session when I don't have time to re-listen to a replay. So that'll be available for folks there too.
Great. Yeah, and it is Jenny's the inspiration behind doing the PDF workbook. I'm not a writer, and so whenever we do stuff together, usually Jenny's the writer on our team. So again, you just need to register. It's free. It's on August 28th at 6 p.m. Central Time. Go to betsybyler.com/braving-the-course. And we are really excited to have you. If you can't attend live, please register anyway. We will send you the replay the next morning. And we look forward to any questions or comments and interacting as well. So thank you so much. Next week, Jenny and I will be back for the fourth and final episode, and we're going to be talking about how therapists getting support from other therapists actually can change what's happening in you, prevent burnout, and really give you a chance to have more joy and energy coming from the work that you do. So thanks so much for listening, and we'll see you next week.
Thanks, everyone.